Yes, so congenital heart disease can affect breathing. It depends again upon the type of the defect and the age of the patient and what else might be going on. But there are several types of heart disease and heart defects that can cause more labored breathing. And so I think if there are now, that's not to say, however, that if a child that comes into the clinic with trouble breathing or a cough that's not going away or something like that, that's not the first thing we necessarily think of, but it is something that we'd want to keep in mind.
Absolutely, especially in a young child that's coming in. Maybe you have no known history of it previously, of having something wrong with their heart, and they're quite young, within the first month of life. It's definitely something that, as a general pediatrician, we're thinking about and doing very close exams on, and getting those oxygen saturations that Dr. Taggart talked about previously. I had one other question that had come to my mind, so something that families and mothers may wonder about. Is there any medicine that they can take during pregnancy to kind of help decrease the risk of congenital heart disease? Because we think about, we'd have women taking folate to kind of prevent spinal problems. What about for heart disease?
So we haven't really identified a good medication to take during pregnancy. So we sort of latch on, take the folic acid because we know that can help. But as far as heart defects are concerned, I think if we can look 50 or 75 years in the future and we've figured out the whole genomic code, all of our chromosomes and everything, we'll probably identify what the cause is for most of these defects. And it seems, at least, that for heart disease, it's not a whole lot of environmental factors. It seems to be predominantly related to probably some genetic defect that we don't recognize, and so medicine isn't going to make a difference in that. We are a non-profit private hospital, which means that we're not in the business of making money, but we're not funded by the government. So we are paid through insurance companies for the care we provide. Some patients who are able to, they pay out of pocket on their own, potentially. We do get some government funding through grants and through Medicare and Medicaid payments. And we're also funded partly by research, in fact, to a great deal by research. The research that's performed here at Mayo Clinic, a portion of the funds that are given to us either through private grants or through government grants and scholarships, part of that covers the day-to-day operations of the clinic. I don't know if you have any thoughts about that.
I was curious if you could just talk a little bit about the research that's coming out of, especially your department, which is incredibly robust with the amount of research that they're producing each month, specifically in congenital heart disease or rhythm problems.
Yeah. So we always have a number of projects that are ongoing, and it's always exciting to participate in that. Some of the fun stuff and the exciting stuff that we're dealing with right now has to do with hypoplastic left heart syndrome. So that's one of the less common but very serious types of heart disease, where the left side of the heart, the side that typically pumps blood to the body, isn't fully formed and can't perform its job to pump to the body. And historically, how that's been treated is by a series of complicated operations that kind of direct the blood over to the right side of the heart and allow it to pump to the body, and then allow the blood to drain sort of passively to the lungs without being pumped. The problem with the heart, with that arrangement, is that the right side, the right pumping chamber, is not built to pump against high pressure like what we have in our blood pressure in our body. And over time, the heart will fail almost universally. And so those kids can do very well for years, but often when they're teenagers or even before then may need a heart transplant. So the research we're doing right now in that is through our WANIC program, provided and it's funded by some very generous donors. The WANIC family of Ashley Furniture, they had a child with hypoplastic left heart syndrome, and what we're looking into is stem cell research to help improve the function of those failing right-sided pumping chambers. We've done some studies in kids already by harvesting their own, harvesting sounds a bit like a bad word, but we collect the blood at the time of delivery from the umbilical cord. We freeze it and store it, and then at the second operation we inject it into the heart muscle, and then we follow them and see how their heart function progresses. And we have a few number of kids right now. It's not a huge number, but we have seen some improvement already, and so that's very exciting. More recently, we started with intracoronary infusion, so through a catheter, We put a catheter in the coronary arteries. Those are the arteries that supply blood to the heart muscle, and we infuse the stem cells that way. And those are in older patients and adults, and the stem cells from them we've taken from their bone marrow. We've done 2 patients that way over the past. We just started doing it in December. 1 patient in December, 1 in January, and we're excited about the prospect of taking that further and further. We have some research, animal research with some pigs, and that we're going to be involved in. So a lot of exciting things coming out of that, and very hopeful things, not just for hypoplastic left heart syndrome, but information that we could hopefully apply to other heart defects as well.
Absolutely. And you can find out on the Mayo Clinic website if you're looking to try and participate as a patient in studies and stuff. That if you're interested, you can always go to the Mayo Clinic website, and they'll have active studies where they're recruiting patients. That's all for today. Thank you for joining us. I think we had a wonderful discussion. Thank you, Dr. Taggart, for coming. This was really beneficial.